Um, my topic today about what's the musculoskeletal manifestation of hematological disease. As you know, our area here is very common, especially hereditary blood disease. So we highlight in this manifestation. Okay. Hematological diseases may present primarily with musculoskeletal symptoms, as most hematological diseases are associated with rheumatological manifestation. So the rheumatologist must be aware of patients presenting with musculoskeletal manifestation and may actually suffer from a serious underlying hematological disease. We'll start with a very common disease, sickle cell disease, which is a group of genetic hematological disorder that result from mutation in the gene of beta-globulin chain of hemoglobin molecule. In Saudi Arabia, that carry a very high prevalence of sickle cell disease worldwide and affecting up to 2.6% of the total population. The patient with sickle cell disease presented with pain, bony pain, and many musculoskeletal manifestation, including the orofacial pain, dactylitis, avascular necrosis of the bone, of the joints, vertebral collapse, secondary osteoarthritis, non-inflammatory synovial effusion, osteomyelitis, septic arthritis, and osteoporosis. So we have to be aware about all these manifestations. The main mechanism for these manifestations is hypoxia, secondary to sickling of the RBC, leading to hemolytic, what is the pointer? There's pointer here, pointer. Oh no. Leading to hemolytic anemias and extra. Okay. So, okay. Anyway, the hypoxia will cause hemolysis and anemia, this leading to extramedullary hematopoiesis and marrow hyperplasia. This will result in the osteoporosis and fracture. Vasoconstrictors can cause severe pain, and this is the main presentation of the patient with sickle cell disease. This will lead to hypoxia will lead to osteonecrosis of the two important joints, especially the hip joint and the shoulder. This will lead to avascular necrosis and dactylitis. Infection also can presented in the bone, causing osteomyelitis and septic arthritis. Okay, and this one is Okay. As you see here, there is the infarction of the long bone here, this one, and in this one you see collection of pus to this osteomyelitis. Dactylitis, which is, we call it hand-foot syndrome or aseptic dactylitis, is a common presentation of sickle cell disease. This condition is caused by infarction of the small bones, the carpal bone and metatarsal bone, as well as the proximal phalanx. Avascular necrosis is a very common complication in sickle cell disease and defined as cellular death of bone combinant due to interruption of the bone supply, leading to death of the bone. The bone structure then collapses, resulting in pain, loss of joint function and long-term damage of the joints. Avascular necrosis, also known as other names, osteonecrosis, aseptic necrosis, and ischemic bone necrosis. There is classification for the avascular necrosis, which is the Association Research Circulation Osseous classification into 5 types. We have stage 0, which is the plain X-ray will be normal, but the MRI will be abnormal. The MRI will be normal in this stage, and usually there is no symptoms. Stage 1, the plain X-ray is normal, MRI is abnormal, and clinically there is mild symptoms or no symptoms in this stage. Stage 2, which is in which there is the plain X-ray showing trabeculation bone changes with changes in the subchondral bone, presenting, but the joint space is preserved. MRI is abnormal and diagnostic appearance. Usually, this patient they are symptomatic. Stage 3 is presence of trabecular bone changes and subchondral fractures, which is, we call it the crescent sign or subchondral bone collapse with the preserved joint space. Clinically, the patient have symptoms, pain, and restriction of movement. And this stage was subdivided into 3A and 3B according to how much collapse. If it is more than 2 millimeter, we call it stage 2B, and less than 2 millimeter is 3B will be more than 2 millimeter, and 3A is less than 2 millimeter. Stage 4, it's the advanced stage. There is a feature of osteoarthritis with distorted femoral head change. There is acetabular changes and marrow joint space. The patient is usually very symptomatic with restrictive movement in all range of motion of the hip joint. And this is the X-ray of the 5 stages, okay? In the last one here, you see in the class 4, it's almost collapse of the head of the femur. Okay. The shoulder also, the humerus is involved the same, and as you see, there is here collapse of the head of the humerus. Vertebra can be involved due to recurrent infarction of the vertebra, and it will make a shape, they call it H-shaped vertebra. And this is classical one here. You see here, like H-shape. Okay, this is clear. And here in the middle, you can see the bone infarction, okay, in A and B. Leg ulcer can be seen also in sickle cell disease, but not common here in our area. We don't see it frequently. Thalassemia is a second hereditary blood disease. It's the most common monogenic disease worldwide. It's causing hypochromic microcystic anemia, hepatosplenomegaly, extramedullary hematopoiesis with secondary skeletal deformities leading to skeletal dysplasia and growth retardation. And this is classical phase of we call it thalamic phase, and when there is a protrusion of the frontal and the maxillary bone, and also bridging of the press of the nasal bridge, there is depression. Okay, thalassemia is associated also with osteoporosis, which is present in up to more than 70% they can develop fracture. And low bone mass and osteoporosis increase the risk of insufficiency fracture and occurring up to 90% of patients affected with thalassemia. Okay, this is the mechanism of the osteoporosis in thalassemia. It is multifactorial. The bone expansion, the hypogonadism, in these patients, they will have hypogonadism, deficiency of some hormones like growth hormone, and Dr. Abdel Mohsen will talk about the osteoporosis, altered pattern of cytokines, iron bond deposition, and iron overload. Dysferxamine can also cause vitamin D deficiency and genetic background. Okay, this picture showing the extramedullary hematopoiesis that can be seen also near the spine and vertebra. Hair on end appearance can be seen in the skull, which is secondary to marrow hyperplasia. And as you see here, we call it hair on end appearance. Another disease, the hemochromatosis, is a disorder that caused by excessive iron deposition, and there will be multiple organ dysfunction affecting the hemochromatosis, including the liver, the affected organ, liver, pancreas, heart, thyroid, joint, skin, the gonads, and pituitary. And up to 80% of hereditary hematochromatosis patients develop chronic, progressive, non-inflammatory arthropathy, which is usually the presenting symptoms. And this is showing the affecting of the joint. Here, this is in the same patient in 5 years difference. This is affecting the second and third metacarpophalangeal joint. You see here the destruction and decreased joint space and some osteophytes in the joint. Hemophilia, as you know, it's hereditary cause and causing bleeding problem in the joint. And the musculoskeletal manifestation is frequently affected. There will be repeated bleeding in the joint, either by mild trauma or sometimes spontaneously. This will cause, we call it hemophilic arthropathy, disabling and deforming joint with both degenerative and inflammatory feature, which include articular cartilage loss, bone erosion, and synovitis. And this is a picture of, you see, there is big collection of blood above the patella. This is hemarthrosis. And this one showing the destruction, which is after repeated bleeding in the joint, there will be destruction of the, here you see some effusion, which is most likely blood, decreased joint space, and subchondral erosion, and the feces marrow compared to the left side is narrowed and deformed. Leukemia. Leukemia is a group of neoplasms developed from malignant transformation of the hematopoietic cells. Leukemia are classified as myeloid or lymphoid according to the type, the cells which is involved. Musculoskeletal manifestations are common in leukemias, mainly due to leukemic cell infiltration of the intramedullary bone marrow space. And it might present with diffuse osteopenia, osteolytic lesion, mainly in the metaphysis of long bone, and they might present with pathological fracture. Osteopenia, with the invasion of the leukemic cell in the bone, there will be osteopenia and expression due to expression of the osteoclastic cell and suppression of the osteoblastic cells. And this is showing here the infiltration, the lytic lesion in the bones, secondary to invasion of the leukomic cell in the bone. Lymphoma, another also malignant disease. Non-Hodgkin lymphoma is hematological malignancy manifested by uncontrolled proliferation of B and T cells or macrophages, and may cause arthritis. And the mechanism of which is poorly understood, but it could be due to invasion of these cells in the bone marrow or related to cytokines in the synovial. Multiple myeloma is also a clonal or plasma cell proliferation characterized by abnormal increase of monoclonal immunoglobulin, and excessive production of this plasma cell can ultimately lead to specific end organ damage, most commonly manifested in the picture of hypercalcemia, renal dysfunction, anemia, bone pain, compared with and accompanied by lytic lesions. Okay, osteolytic lesion can be seen in multiple myeloma, and there is here from the sacroiliac joint, there is big lytic lesion in the iliac bone. Osteoporosis is seen commonly in hematological disease, and these are some of the examples that can cause osteoporosis. In multiple myeloma, systemic mastocytosis, thalassemia, hemophilia, sickle cell disease, and monoclonal gammopathy of undetermined significance. I think, that's all. Thank you.